अर्थात chardipratishedham अध्यायं व्याख्यास्यामः त्वयाचबुधनन्दनन्तरे chardi or vomiting. The vomiting can be a symptom of many of the diseases, and in the present day situation we consider vomiting as a symptom of many of the diseases than really an independent disease. Now Shushra has considered again chardi as an independent disease in certain conditions, whereas the chardi is also a lakshana of many other hundreds of the diseases. Now when the vomiting occurs due to the type of the food which is consumed or the other specific reasons, then the chardi is considered as a vyadhi on its own, and those causes are adidavaihi, अतिस्निग्धेहि अहृदेहि लवणेहि अति अकाले च अतिमात्रेश्च तथा असात्मेश्च भोजनेहि श्रमात् क्षयात् तथा उद्वेगात् अजीर्णात् कृमिदोषतः नार्याश्च आपन्नसत्त्वायाः तथा अतिद्रुतम् अश्नतः अत्यन्त आमपरीतस्य छर्देः वै सम्भवोद्भवं भीभत्सैः हेतुभिश्च अन्यैः द्रुतम् उत्क्लेशितो बलात्. Now the causes of chardi mentioned in Sushruta are due to excess of liquid food or excess of oily food, those who are not really tasteful or those who are not liked by the patient, or those with food which is very salty, and a food which is consumed improperly, improper timings and improper quantity, and certain food substances which are not amenable to the person or which are not acceptable to the person, or due to excess of straining, or even due to the emaciative disorders, psychological disturbances, distress like udvegata, or ajirnat, improper digestion, krimidoshadha due to the worms in, or maybe the infective pathologies, naryashchapanasattvaya, pregnancy can be a cause for the chardi, or those who eat very fast as such, or where there is a accumulation of intermediary metabolic products in the body, it's a metabolic causes like, or those who are really seeing something which is not liked. Vivatsaha is something which is not liked. There will be aggravation of the diseases and that aggravation of the doshas, and that produces the chardi. Definition of chardi or the vomiting is chadayan annam vegehi ardayan angabhanjanehi niruchyate chardihi dosho vaktrad vinishcharanna. When the person attempts to close the mouth or keep a hand or something against the mouth, and where there is a reverse osmosis, where there is an attempt by the body or effort by the body to push out the contents, and the contraction of the muscles of the body, all these three together are seen in chardi. Doshan udirayan vruddhan udano vyanasangatah urdham agacchati prisham viruddhahara sevanat. The pathogenesis of chardi is related to udana vata and vyana vata, getting involved with the doshas, and when there is a reverse peristalsis or anti-peristalsis, that is considered as chardi. The prodromal symptoms of the chardi, before you vomit, the symptoms which tend to occur would be prasekaha, hridayakleshaha, bhaktasya anabhinandanam, purvarupam matam chardyaha, excess of salivation, a discomfort in the chest, and improper appreciation of the food or taste of the food. These are considered as prodromal symptoms of the chardi. Yathasvanti vibhajayate prachyardayate फेनिलम अल्पम अल्पम शुलादितो अभ्यर्थित पार्श्वपृष्ठः श्रान्तः सघोषम बहुशक्कषायम जीर्णे अधिकम सा अनिलजावर्णिस्तो. When a patient vomits foamy contents in the vomitus, and the quantity of the vomitus is smaller, like, and there is a acute pain in the abdomen, and it could be anywhere in the abdomen as such pain, and the patient may even have a retching, a loud sound produced, or kashaya rasa, when the vomitus would have some bitter taste as such, and even after the consumption of the food or even after the digestion of the food, the patient may have the vomiting. That's considered as a vataja chardi. Now we will come to that different etiological factors of the vomiting as we see now. Now among them, one of the causes is the spasmodic vomiting. Like any patient having any intra-abdominal painful pathology like appendicitis, cholecystitis, renal colic, etc., there would be a spasm of the muscles of the abdomen and the muscles of the gastrointestinal tract. The pylorus becomes closed and there would be vomiting. And that kind of the vomitus produced due to the reflex activity. We call it as a reflex vomiting, where the vomiting is induced due to a spasmodic pathology, a pathology other than that of the stomach, and due to the painful pathology, there would be a reflex spasm of the stomach, and in that condition, characteristically, the same would be the features, like there would be somewhere the pain in the abdomen, either anywhere in the abdomen, like lower or upper abdomen. Now, you may see such condition quite frequently. Patients who have spasmodic dysmenorrhea, patients who have renal colic, patients who have appendicitis, cholecystitis, vomiting is a common symptom there. And in these conditions, it's characteristically same. The patient would have a rigorous vomiting, and once the stomach is empty, there would be only retching. There may not be really vomitus coming through, and quantity of the vomitus is always related to the presence of the food in the stomach. So initial bout of vomiting would be more, but gradually it gets reduced. That's the typical Vataja Chardi. Yo amlam brisham katiktapatraha pidam saraktam haritam umegva sadaha tosha jvara vakrashoshaha murchanvitaha pitta nimittajasa. Pitta Chardi would be having sore content in the vomitus, and the patient may have this pungent taste in the mouth. It could be yellowish or maybe even blood stained or greenish in the content, and there would be burning sensation throughout the body. Systemic symptoms like fever also can occur, dryness of the mouth also can occur. These are typically seen in case of the vomiting induced due to gastritis-like conditions, inflammatory pathology of the stomach, peptic ulcers, or gastritis-like condition due to excess of food which is producing the vomiting, or reflex vomiting, like where there is a esophageal reflux-like conditions. Or in such conditions, this is exactly the same, where the presence of the bile is characteristic. It is also called as bilious vomiting. In conditions of gallbladder pathologies also, it could be occasionally the same. So we can identify the patients either Vataja or Pittaja with these pathologies. Then Yohasaroma Madhuram Prabhutam Shuklam Himam Chandra Kapanavidham Abhaktaruk Gaurava Sadayuktaha Vame Gurnisa Kapakopajasyata. When the patient would have Madhura Rasa, that's the vomiters would not have the bile taste, bile-less vomiting, and the content could be whitish in color. It may be, there could be a lot of mucin, Sandrakapanvidham, mucin contained, and the patient may have vomiting even when the patient doesn't consume the food. Even when the patient doesn't consume the food, there will be vomiting. Such a condition is a kaphaja. Now, these are typically produced in obstructive pathologies. When typically in a pyloric stenosis, exactly the same, like there would be no bile and hence bile-less vomiting is characteristic. In the distal obstruction, intestinal obstruction pathology, the other part, like the pain, vomiting presenting even when the patient doesn't have the food, contain the food, vomitous quantity increasing is characteristic, but there may be some amount of bile there. But anyway, we can consider kaphaja chardi as the vomiting produced due to obstructive pathology. Sarvani Rupani Bhavanti Asyam Sarvadosha Prabhava Madato. When all the features are there, that's considered as Dosha. Bhipasaja, Dausaja, Amajata, Satmekopad, Kumijata Yahi, Sapanjami Tam Jabhaveta, Doshat Shayanema, Yathotamado. In the vomiting produced due to the seeing something which is dislike, that surroundings, stimulus due to the surroundings, or due to the dausada, that's due to the pregnancy induced, or amajavyadi, or asatmya, intolerance of the food, or krimija, these infective pathologies. In all the conditions, the dosha lakshanas like Vataja, Pittaja, Kaphaja lakshana have to be identified, and you have to manage the same. Shula Hrillasa Bahula, Krimijati Visheshadaha, Krimi Hridrogatulyana Lakshananja Lakshita. In the Krimija Chardi, due to burns in the abdomen, in the gastrointestinal tract, there could be more of salivation, more of pain, and there could be the symptoms like Hridroga, chest pain also could be seen in such conditions. Kshirasya Upadrave Yuktam Sasrak Puyam Sachandrikam Chardim Prasaktam Kushalo Narabheta Chikitsidam. patient who is very much emaciated, weight loss conditions, and there could be either pus or maybe the blood stained conditions where the multiple color rings could be seen. Such condition could be considered as asadhya, incurable, often seen in case of malignancy of the stomach. Amashay utklesh bhavahi sarvaha tasmadhitam langhanameva dasu. In all the condition of vomiting, the primary ultimate change which occurs would be in the amashay stomach. Though the real triggering causes could be somewhere else, the stomach is the most important involved organ, and hence one of the first aid of the treatment would be to keep the stomach empty. So langhana is suggested as a treatment condition. Now, in the present day situation, the causes of the vomiting could be of many, and we usually categorize them into, or how the pathological changes occur would be, or how the vomiting act would be. It's all related to the central, primarily there is a central nervous system pathology. The vomiting center present at the thalamus can get stimulated due to psychological stimuli, or it could be due to the presence of the drugs in the blood acid, or the sensory stimuli like from the oral tract, gastrointestinal tract as such, where there is some irritant substances over there. These would be directly acting on the chemoreceptor zone, and that produces vomiting. When the gastrointestinal food, the presence of the food in the stomach produces a mechanical stimulus, then the stimulus could be through the vagus, and it directly reaches to the nucleus of the solitary tract, and then again the induction of the vomiting would occur. If there is of course, the hypothalamus also could be stimulated due to the local pathologies, irritation of the hypothalamus, or what we call as vomiting center, as in case of the CNS pathology, space occupying lesions like conditions. There could be direct stimulation of the chemoreceptor trigger zone, and that also can produce the vomiting as such. The act of vomiting would be starting with the lower esophageal sphincter relaxation, and there could be retrograde peristalsis. There has to be retrograde peristalsis, and all the muscles involved in these would be properly controlled. So act of vomiting is a controlled act, and it needs a complex reflex mechanism, and that results in the contraction of the abdominal wall and the respiratory muscles contraction, and there has to be a coordinated pharyngeal muscle this activity which should be dilated like, so that relaxed like, so that the contents of the vomitus could be coming through the mouth. Correspondingly, there would also be a simultaneous stimulation of sympathetic nervous system, and hence almost every patient during vomiting, every act of vomiting would be accompanied by tachycardia, and the peripheral blood vessels can be reduced, or peripheral blood vessels will be constricted. Either there could be salivation or sweating due to that corresponding sympathetic stimulation. The very common causes of the vomiting which we see are either psychogenic origin, or CNS stimulation pathologies related to CNS like these neuronitis, or maybe migraine like conditions, or even space occupying lesions, or it could be the alcoholism, which is a well known cause for that vomiting, where there could be both central nervous system involvement as well as a local gastric involvement. There could be, it could be due to many drugs like many of the drugs, NSAIDs, opiate, and so on. And infective pathologies like hepatitis, gastroenteritis, urinary tract infections can produce vomiting. Metabolic pathology like diabetic ketoacidosis, Addison's, or a specific condition called as a cyclic vomiting syndrome. Cyclic vomiting syndrome has both psychogenic origin as well as metabolic origin. And the other common causes are gastrointestinal tract pathology like peptic ulcer and gastric ulcer conditions. Systemic disorders like uremia. Acute abdominal conditions like appendicitis, cholecystitis also can induce the vomiting. So the cause of the vomiting could be many. And one of the method of exam, one of the important clue which can give you some idea about the type of vomitus could be looking at the color of the vomitus. Now that's what Sushruta also said. In the present day situation, you have a standard color chart, foamy vomitus, which is typically mentioned in Vataja Chardi. Reddish one would be often seen in case of the Pittaja Chardi, and in Kapha Chardi also it is a clear vomiting where there would be no much of any contents as such. Now, the same pathologies or same sequences could be even interpreted in the present day situation. So, that color code which is mentioned in Sushruta is also applicable in the current situation. That's all the point. Like, once the patient has a vomiting, which could be due to any other causes. So, in any case of vomiting, the most important part would be to identify the primary cause for the vomiting. But along with that, certain common complications would occur in any case of vomiting, and those common complications are dehydration, electrolyte imbalance, aspiration, and hence pneumonitis can occur, or there could be a rupture of the lung and pneumothorax could occur, or rupture of the esophagus and hence the bleeding, or maybe the mediastinitis could occur, Mallory syndrome, that's the esophageal rupture due to the conditions. Patients who have repeated vomiting may develop hernia, or a patient who has a hernia, when the patient vomits out due to that sudden increase in intra-abdominal pressure, the contents of the hernia may get projected out and they may even get obstructed, and later complications of the hernia could occur. Of course, it is also true that a hernial obstruction itself can be a cause for the vomiting, or a hernia, during vomiting there could be injury to the throat also. Now that's about the frequent complications, and hence you need to take care of those issues when you manage. Now from the correct Sushruta's point of view, the management of chardi would be Vamishu Bahidoshasu Chardanam Hidamchade Virechanam Vakurvita Yatha Doshochayam Bhishaka Sansargascha Anupurvena Yathaswam Bheshidayitaha. Now the primary treatment of all cases of vomiting is a chardana, to keep the stomach empty. That's the primary aim. Keep the stomach empty. Either you have to make the patient vomit out. Now one of the options which we may just suggest would be Rell's tube aspiration. We have to gastric aspiration. Particularly in obstructive pathologies, the primary treatment of the act of vomiting would be put in a Rell's tube and then aspirate the contents, gastric aspiration, or do not give anything orally. Nil orally would be the first of the treatment. Or the Virechana Makurvita, in specific conditions, Virechana, to facilitate the passage of the food in the stomach, Virechana Dravyas could be given, or a specific medical management based upon the condition. Sansargascha Anupurvena Yathaswam Bheshidayitaha. As per the primary cause, the treatment has to be given. Laghuni Parishushkani Satmani Annani Chachareta Yathaswamti Kashayani Duragnani Privilegate. Once the patients that bouts of vomiting are reduced under control, patient may have to be given a dry food, and which is acceptable, amenable to the patient's constitution, should be given in small quantities, and it should be laghu ahara, or Dwaragna Kashayas could be given. Hanyat Kshirakatam Pitam Chardim Pavanasambhavam Sasaindavam Pibet Sarpe Vatat Chardim Maranam Mugga Amanaka Yusho Vasasarpishka Sasaindavaha Yavagum Madhumishram Panjamuli Kram Pibeta Pibetva Rekta Sindhutam Palamlam Vaishkiram Rasam Sukhosna Lavanam Chatra Hitam Sneha Virechanam. In case of Vatajat Chardi Lakshana, the common treatment could be Kshira and Ghata. Milk with ghee can be given for Vatajat Chardi, or ghee with the Saindhava Lavana, or Mugga Amalaka Yusha, or so on, Panjamuli Yavagu, or Phala Amla with the slight lavana added, or non-vegetarian Vaishkiram Rasam, the soup of birds also can be given. Pitta Upashana Shamaniyani Pakyani Shishirani Kashayani Upayuktani Ghanti Pittatran Omim Shodhanam Madhurishchatra Draksharasa Samayihi Balavatyam Prashamsanti Sarpihi Tailokamacha. In Pitta Jachardi, all Pitta Hara Chikitsa, Shita Virya Dravyas have to be given in the form of either Kashaya, or the patient may also can be given Virechana, Shodhanam Madhurishchatra Draksharasa Samayite. With the Draksharasa, Shodhana can be given, or Tilvaka Dhrita also can be given. Arabodhadi Niriyuham Dashanga Yoga Memaja Payeta Asa Sakshodram Kapajayam Chikitsakaha. In the Kapajachanti, Arabodhadi Kashaya with the Dashanga Yoga can be given. Kritam Gurutya Vidivat Kashayam Himasanjitam Tisrushapi Bhavet Patyam Makshikena Samanvitam. Guruchi Kashaya with the honey is something which can be given in all Tridosha variety or all conditions of the Chardi as such. Then Bhivastajam Hrudyatamehi, Dauhadim Kamshidehi Palehi, Landhanihi Vamanisha Ama, Satmihi Satmi Prakopajam, Krimi Hindrokochapi Krimijam Sadhe Pumim. If the vomiting produced due to seeing some objects which are not acceptable, in such conditions you have to give something which is acceptable to the patient. The surroundings have to be kept clean, and the patient has to be kept in an environment where there would not be any such a stimulus, psychological stimulus. Or in Dauhadya, that's the pregnancy induced vomiting, you have to give whatever the patient likes. Kamshidehi Palehi, the likes of the pregnant mother has to be respected. Amaja condition, Langhana and Vamana are the treatment. Satya Prakopaja, that patients who have hypersensitivity to the food, you have to change the food habit into the Satya, which is acceptable to the patient. Krimi, the Chardi has to be treated as in case of the Krimija Droga. Vidrekta Yathadosham Shastam Vihimanantram. Once the patient has recovered, then based upon the signs of the dosha, the treatment can be given. Dadhitva Rasasamsaktam Pipalim Makshikanidam Muhur Muhunaro Vidva Chabdibya Pramchate. The general specific treatment for the Chardi would be Dadhitva Rasa. That's a pomegranate juice with Pipali and Makshika has to be given repeatedly. And Samakshikaha Madhurasaha Pitaha Tandulamana Tarpanam va Madhuyitam Tisrunama Bheshajam. This Madhurasa is a sugar cane juice with the Makshika honey and with the Tandulam rice water. Which can be given in all the types of Chardi. Swayam Guptam, Sayashyaham, Tandulam Madhutravam, Pibe Devagum Athava, Siddham Patrehi Karanjajehi. Another of the yoga where Swayam Gupta, that's Nasuguni, can have with the Madhyasti and Tandulambu has to be given. Yukta Amdalavanaha, Pistaha, Kustumbaryo Athahitaha, Tandulambu Idam Khadeta Kapitam Trishanenava. So, food prepared with the kustumbru, that's kothambari, and with the amla and lavana dravyas, tandulambu with the tandulam can be given. Sita chandana madhvartam lishva makshika shakarda, with the sita chandana, that's chandana and sugar candy with the madhu has to be given with the makshika shakarda, jelmena, that the wax, bee wax. Pibet yet payo agnisattam cha nirvapyam grahagodhika sarpik shaudrathitan vapi lata shaktun pibet tatha. Another of the certain unusual protocol is grahagodhika, that's lizard, house domestic lizard has to be heated, and then it has to be kept, dipped in liquid containing sarpi and kshaudra or Laja Shaktu. Sarpik Shaudra Sidopeta Magadi Mali Hetrata, Dhatri Sechandanama, Christam Mudgadalambuna. Sarpak, another of the yoga where Dhatri Rasa and Pipali Rasa has to be given. Kola Amalaka Madjanam Rishabha Trisugandikam Sakshodram Sali Lajanam Yavaguma Pivenadaha Grayani Ubhaya Chapi Manograna Sukhanija Jangalanija Mamsani Shubhani Panakanija Bhojanani Vichitrani Kuryat Sarvastu Atandritaha. In general, in all the patients, you have to give a liquid diet which is easily digestible, and to ensure that the patient would not have a further stimulus of vomiting, you have to give something which smells well and acceptable to the patient. And it could be, if the patient is a non-vegetarian, mamsarasa, soups of different flesh also can be given, and the food which is prepared in such a way that the patient likes it is the important issue. Now, from the current point of view, when a patient comes to you with a certain specific type of the vomiting, I just have listed few of the common types of the vomitings which we see in the clinical practice and how I manage. Patients with the food poisoning and vomiting, Agnitundi Ananda Bhairavi is the usual prescription. Gastritis induced pathology, Sudhshekara Kamaduga. Peptic ulcer where the patient would have a chronic condition, then Sudhshekara Kamaduga and Godantya Patikara Buni Badikwata where the treatment has to be longer. Worm infestation, Krimicular Rasayana with the Agnitundi. Hepatitis, Mrutyunjaya Arogyavardhini Kumari Aksava. Patients who have a central nervous system pathology, vestibular pathology, like migraine-like conditions or vertigo-like conditions. Kamaduga Smiksagara is the usual prescription. Patients who have neurosis and hence the vomiting occurs, psychiatric disturbances, Smiksagara Saraswati stays well. Hyperemesis gravidarum, pregnancy-induced vomiting, multiple rasana is the usual prescription. Now, so important reason, these are the general symptomatic treatment. When I say this, it's not doesn't mean that it's a complete treatment. The primary pathology has to be treated otherwise, but as a symptomatic treatment can be well. And one common drug which can prevent any sort of the vomiting, even in case of toxic vomiting like uremia, Mayura Pichabhasma is one of the specific remedy which can reduce the symptom of vomiting temporarily as a symptomatic drug, like the contemporarily used anti-emetic drugs. With this, we conclude this chapter. It is Sushupsamhitayam Uttaratantrante Kayachikitsa Tantre chardipratishedha nama ekadashodhyaya adhita ekonapanchashttamo adhyayah. So if there are any questions, I'll try to answer and then wind up. Right, there are no questions, so we'll wind up a bit early today.